Hello, Kelsey.
Hi,
I'm Jessica. It's very nice to meet you.
nice to meet you.
So you've already signed and read your informed consent. I just did want to run through the confidentiality part of that real quick for you because it is very important. So everything that you share in this room will be between me and you, unless, of course, during our therapy session, any suspected or if I'm, um, told about any abuse toward children, the elderly, or anybody with a disability, then I do have to report that to the authorities. Also, if you are to tell me that you would like to harm yourself or another person, it's up to my discretion to report that as well for your safety and for others. Do you have any questions about that? Okay, perfect. Well, why are you here to see me today?
Well, my roommates kind of encouraged me to come, but I know I needed someone's help too. It was just a little, not a little, but just having so many crying spells. Just been really sad lately, and it's starting to interfere, I guess, with my friends. Not that my roommates encouraged me to come, so.
Okay, well, I'm very sorry to hear that. So when you're saying that it's interfering, you said with your friends, how is that interfering in your social life?
I'm just not really doing anything with anyone anymore. Like, I used to have my best friend Gerald come over, and I don't even have him come over anymore. I just don't leave my room too much anymore.
It's just a little withdrawn.
Yeah.
Are you engaging in any activities that you previously enjoyed?
No, I mean, I used to like work out all the time and do pole fitness, and I'm not even interested in doing that lately.
Wow, pole fitness sounds pretty interesting.
Yeah, it's fun, but I don't know. It's just not something I'm feeling like doing lately.
Yeah, it's kind of hard to get yourself motivated when you're not feeling the best about yourself or about your situation.
Right.
Um, so when exactly did these symptoms start? When did this problem arise for you?
Um, I mean, I was fine until I got back from Nicaragua, and then I just like missed my family so much, and it's been almost a little over a month now that I've been back, and I just can't seem to shake.
Okay. Was that the only thing going on in your life during that moment?
Yeah, I mean, before I went to Nicaragua, I was like, I guess, kind of anxious to, I don't know if it was to get there or just because I haven't seen them in 5 years, but like coming home after spending such a great time there is like just disheartening. I just miss my family.
So, are you originally from Nicaragua?
I'm not. My mother is, and we would go every summer. But the last 5 years, I haven't really gone, so I feel like I kind of missed a lot in my family. Like last time I was there, my best friend had like an infant, and now she's like almost 5 years old. So I just feel like I missed her whole upbringing, and I wasn't there for anything. And my other friends going through a horrible divorce, and I just wish I could be there more for them.
Do you communicate with them often? Uh,
I mean, life happens, so like, one has a kid, one's married, they're in school, so it's kind of like hard, I guess, to get in touch with them.
it's difficult, but would you say that you're worth their time and they're worth yours?
Yeah, I just don't want to interrupt their life. I know it's just really busy, and you know, I mean, they love me as much as I love them. It's just life gets in the way, I guess.
Yeah, definitely. Well, that's something that we can keep in mind and keep talking about. So have just real quick some medical histories for you. Have you ever participated in any form of counseling or treatment? No?
My mom and I attempted a few years back, but she stopped going after like 3 sessions. She didn't like being told she was wrong.
Okay. Not a lot of people do, but sometimes it's necessary. So did you find anything helpful about it for yourself? I know you said for your mom not so much, but
Personally, I enjoyed it, which is why I was open to, seeing somebody with my roommates suggesting me to do so. So, and personally, I definitely found it helpful.
excellent. Well, I'm glad that you did, and I'm glad you returned. Um, did you find anything not so helpful about your therapy?
I mean, my mom's just difficult, so I'm not really sure from that experience if it was my mom not really participating the way that she should or what, but.
So we're gonna try removing mom out of the situation for now and
Rather worry
focusing
about
on
myself,
ourselves.
yeah.
All right. Well, that's a good first step, self-care. How would you describe your current health?
I'm pretty healthy. I mean, I've been going to the doctors a lot before in Nicaragua for stomach issues. I try to eat healthy and vegan, and I'm just not sure why I have all these issues, and nothing seems to be coming back either from the gastrointestinal doctors or anything like that. So, kind of just in limbo and understanding what's going on with my body. But other than that, I'm fine.
So you've had some blood work done. You've seen an MD for physical recently. When was the last time?
Yeah, I went about 2.5 months ago, and they did, some procedures and things like that to see. And all they said was that I had some inflammation, but no known cause or anything like that. Why? But I would wake up with like horrible stomach pains and things like that. So.
And you did see a gastrointestinal specialist, correct?
Yeah, and they just said it was inflammation, but no, it's not like it was Crohn's or anything like that. So I don't know what.
Well, it is kind of interesting because your body starts to react to some stressors as well, and that stress can also exacerbate any physical symptoms that you are having. Do you ever notice that you have any anxiety?
Oh yeah, I definitely am a thinker. I overthink a lot of things, and I think too much into things sometimes and things like that. But that's just kind of the way I've always been. My mom's a fall of anxiety too, so it's kind of just her way of life, I guess. I don't like to think I'm as worse or as bad as her. She's definitely worse.
And have you had these stomach problems throughout your life, or is this more recently?
I'd say almost for 2 years now that I've kind of had some issues in my stomach, but that's about it.
Is there anything that you noticed going on in your life around that time where you started to get those?
I mean, it got real bad knowing I was going to be spending time with my mom in Nicaragua, and we don't always get along really well, so, but I was excited, nervous to see my family that I haven't seen in a long time too, so it was kind of like a bunch of mixed feelings going on then.
So yeah, it is amazing how our body starts to react to those anxious feelings, and I would like to talk to you more about that after the rest of this, kind of get you educated on some of the things that you could do, like some relaxation to kind of ease your stomach, your central nervous system, everything. So we'll see if maybe doing some things like that, since medically it's not showing any problem. It could be a somatic. That's what we use.
That's great. It's nice to know that I'm not just crazy.
Right.
It's not just reacting to things.
Yeah, and that's actually a common thing with any depressive, disorders, anxiety disorders. you do definitely see it in your body as well. So how many hours do you get in an average night? Hours of sleep?
It varies. One of my roommates kind of comes home and wakes me up sometimes, but I'd like to say 6 hours before I get woken up by my stomach pains.
So you can be woken up by them.
Mm-hmm.
Okay. So do you experience fatigue even when you do get enough sleep or regularly?
Lately, I've noticed I'm more tired in the mornings and things like that. More fatigued. I don't really get up and go anymore. I used to, I work from home, so it would just be going to work would be just going to my desk. I don't even want to leave my bed.
Okay, when did you start noticing that this fatigue was more so even when you were getting a regular amount of sleep?
Definitely when I came back from Nicaragua.
Okay. Do you exercise regularly? We talked briefly about the working out previously and the pole dancing.
Yeah.
Okay, so
I used to, but haven't really felt like it lately.
Since you came back.
Mm-hmm.
Okay. And then just describe your diet for me.
I try to eat really healthy, but I'm just like nervous that, I thought everything was like food allergies or who knows what was going on with my stomach. So I was just kind of restricting what I would eat in order to make sure that it wasn't something that was going to upset my stomach. So I definitely haven't been eating all that much.
Okay. Are you currently on any medications?
No, I'm pretty holistic.
And then, are you receiving any other medical treatment? I know that you said that you were still going to some doctors.
Mm-hmm.
That's it, though?
Yeah, that's the only concern.
Do you currently use or have any previous use of substances?
I drink socially, but I'm like a lightweight, so I don't really have more than one or two. And I smoke marijuana, especially to help with my stomach pains and to help me fall asleep and things like that.
Okay. Do you use it socially as well?
Yeah.
Is that something that you are okay with in your life right now? Is that something that you would like to change?
It's helping me sleep and it's helping my stomach aches and things like that. So I kind of like the effects that I'm getting from it, but.
But are there any negative effects that come with it as well that you notice?
Not really.
So it's more like a medicinal.
Yeah.
Okay.
I self-medicate because I don't want to take any other medication.
I understand. Okay. Real quick, we're gonna kind of talk about like your developmental history and your family a little bit. How was your mother's health during her pregnancy with you?
To my knowledge, good.
Good.
Fine.
Were there any complications at your birth?
Mm-mm.
To your knowledge, did your mother use tobacco, alcohol, or any other drugs during her pregnancy?
I know.
And then, did you have any delays or difficulties during your early childhood? That includes like speaking, toilet training, walking.
Mm-mm.
And did you experience any medical problems or serious injuries during your childhood?
No. Pretty safe kid.
Okay. So for your family, is your father still alive?
Yeah, he lives in Brazil now, so kind of don't talk to him much these days.
So there's not a lot of communication with him.
No, I almost haven't talked to him in about 3 years now.
Is there a reason for that?
It's kind of a weird relationship. Like he was really present when I was younger, and he would go to Nicaragua, obviously from Brazil. It's not too far, so he would meet us there for summers, but it just kind of like stopped coming around. I'm not sure if something happened between my mom and him or what, but he stopped reaching out, so I stopped expecting it.
Were they ever together?
They were never married, no.
Okay. So he primarily lived in Brazil,
Mm-hmm.
and you two primarily lived in the United States.
Right.
Correct?
Yeah.
How did you feel about being separated from your father?
I mean, it is what it is. Like, of course, there were times like I wish he was around, but I mean, I just don't even understand what happened, and I try not to give it too much thought. So.
Okay. And then you briefly discussed you and your mother earlier. Does she live close to you?
Yeah, I go to her house every Sundays for, weekly dinners, but other than that, it's better that we don't spend too much time together.
Sometimes that's just, mother and daughter.
Yeah.
Does anybody else join you for these Sunday dinners?
My uncle every now and then will come, but he's kind of busy sometimes, so I mean, it's whenever he can make it, but it's mostly my mom and I.
Do you have a good relationship with him?
Yeah. He understands that my mom's, full of anxiety, so we get along really well.
Well, good. That I know that you kind of said earlier that you didn't have a lot of family here, but you do have two people. One of them kind of, a strained relationship, but the other you described as having a really good relationship. So you do have some family here.
Yeah.
Yeah.
Just wish I had all of them here.
Well,
or I was there.
Yeah, it's difficult, but it's good to identify the people that are in your present life right in front of you that you can lean on for support whenever you need it. Which is hard when you're feeling sad and you're going through all these emotions and physically you're feeling like this. It's a good thing to have a lot of support. I don't know, do you identify as, more so Hispanic or American or both?
I would definitely say both. I mean, people don't even know that I speak Spanish, but my Spanish is incredible too, so kind of like a hidden identity.
Hidden gem. It's
Yeah.
a great thing to be bilingual.
It is, especially in South Florida. It really is.
Yes. So why? I know the Hispanic culture is very family oriented.
Mm-hmm.
Do you think that maybe has an effect on why you feel so sad and so?
Yeah, I miss them. Like oh no, they just mean so much to me, and it's just really hard being away from them, and then after seeing them for not 5 years, and then going to see them again, it's like I feel like I missed a lot. So just kind of regret not being able to see them in that time, and like just kind of want to fix that and be more present in their lives, but it's hard when you don't live in the area.
Well, there is a beautiful thing called technology, and we're very lucky that we can communicate with people across the world from us. I know that, like you said, people get really busy, but you seem to have a really great relationship with your family members, with your best friend that's over there, and I'm wondering if you could maybe try to communicate with them. There are things such as Skype and FaceTime where you can actually see the person and get a feel more of feeling like you're in their home setting.
Yeah, I have an iPhone, but my friends over there don't. But I'm sure they can Skype. I just haven't really brought it up because I know they're busy with life, and I don't know. I guess that's another way I could be applying that.
Yeah, and if you haven't brought it up yet, you don't know that it's a burden to them or a no, you know.
Yeah.
Okay. Do you have any siblings?
No, I'm only child.
And how does that feel? Do you have any other people in your age group that are in your family, or?
I mean, my cousins and all that, my best friend lives over there, and they're pretty much like family. So we're all going through things in life, like, divorce and kids and things like that, and there's, I'm not there yet, I guess.
Well, divorce is a hardship, and you're going through a hardship. That person needs support. You need support.
Yeah.
Pretty good thing to come together in those moments, I think. And I think looking at it in more of a positive light of how to help one another, and that they do love you and care about you and want the best for you as well. Yeah. So, okay, just a couple more questions. So you said your major cultural influences in your family, and then are there any religious?
My mom's very strict Catholic, but I'm not so much. Like she goes to church for all the holidays and things like that, but I choose to sit them out, so.
Does that affect your relationship with her?
I mean, of course she wishes that I was more, but she understands, like, I'm not the traditional Catholic Hispanic where I stay at home until I get married. Like, I moved out on my own. I'm not gonna go to church just because she wants me to, kind of thing, so.
Well, it's great that she's accepting of your, your acculturation to this culture too. So it's neat that you kind of have where you can enjoy both of the cultures without being judged on that. So did you ever experience any physical, sexual, or emotional abuse or neglect growing up?
I mean, just the normal Hispanic chicleta, and that's about it, but nothing major, luckily.
So even, I know that our laws are a little bit different than elsewhere, the chicleta, but nobody was ever called or anything so nothing like that.
There's just strict discipline,
not an excessive abuse.
No.
Okay. Do any of your family members have history of mental illness or a problem with alcohol or drugs?
My mom's definitely got a lot of anxiety issues, but not really any like drugs or anything. I think my grandfather drank, but I don't know.
Okay. What was school like growing up for you?
It was good. I'm a good student. I definitely did classes after high school, like a medical program that I had originally planned to bring to Nicaragua, but they said that the credits wouldn't transfer, so I'd have to do it all over again, so I kind of just gave up on that dream.
Is that something you would like to explore working toward?
I mean, I'm happy in my career now, so like starting over, not really what I want to do.
And what do you do now?
I'm a medical sales representative, so.
Okay, so you're in the medical.
Yeah, it's
arena.
something I understand and I'm pretty good at, so.
Well, that's great that you're good at it. And have you ever served in the military ever?
No.
Okay. How are you doing in your job performance? I know you work from home, but you said you're having some problems getting out of bed.
Yeah, I mean, my computer's like right there, but I just don't really feel like getting up and trying to sell people things. Like I'm just not. I've been canceling appointments and things like that. So I guess not as good as it should be.
And do you work off of commission?
Yeah, I have a base salary, but my commission's like a big part of my income too, so I guess I'm kind of missing out on some of that by canceling sales.
And is that something that you would like to work on, trying to
Yeah, I
get
want
better?
to. Yeah, I
at
want to
that?
make money. I just haven't really had the drive to do it.
And it seems like you enjoy it, so that's
It's not hard, so.
so legal history, any arrests, any current legal issues that you're going through? Okay. What is your sexual orientation?
Heterosexual.
Okay. And have you ever been in a relationship?
Yeah, I just ended a relationship shortly before leaving Nicaragua. It just wasn't right for me, so.
How long did you date that person for?
Almost 2 years.
Did you have any of these depressive symptoms after that?
It was more of a mutual breakup, and if anything, it was like causing my anxiety, I would say, because it just wasn't the right person for me, and I knew that, and it was just hard to like go through with the breakup, if anything. So.
Right. So did it feel, I don't want to put words in your mouth, but more relieving than?
Yeah, I would say that it was, yeah, it wasn't, I think it was harder for him than it was for me, kind of thing, so.
And you're okay on that front now?
Yeah, we're friends, so it's, it's a good, so we have a lot of mutual friends, so I needed to kind of be that way.
Well, that's very good.
Thank God.
It's a lot easier whenever you don't have to go through,
Yeah.
the horrible breakup. Have you ever had sex before?
Yeah.
And it was a good experience? Yeah, are you pretty comfortable with sexual activity, talking about it with me? Okay. So have you ever been pregnant?
Mm-mm.
Have you ever been tested for STIs?
Yeah, but nothing.
Nothing? Okay. And do you have any current or past sexual concerns that you would like to talk about? No? Okay. So have you ever had any suicidal thoughts?
Recently, not really like killing myself, but more so like just better off not here kind of thing, which was a scary thought in itself. But I'm not like I'd actually like do it. I don't know. I was more scared that I even thought that.
Okay. And have you ever attempted before?
No.
Any self-harm? Okay. Now, it is concerning that you've even thought that, so I just want to make sure real quick that you do, obviously I'll give you my contact information after you leave today. Feel free to, call me at any time if you're feeling like that. Also, if you do any of your roommates know, or you feel comfortable talking to anybody?
Not about that really, but I mean, my one roommate, I'm sure if I told her she'd be supportive of me. The other one, I don't know. But she's supportive too. She's just in her own little world sometimes. So.
Right. But maybe having somebody that you live with, not telling them everything, but just making sure that you have somebody there that you know that you
my
can.
one roommate, I can definitely, go to her if I need anything. So.
Very good. And so it's more of like a I don't want to be here, rather than have you thought about any ways to actually do it?
No.
Okay. All right, thank you. And have you ever had any homicidal thoughts, wanting to hurt anyone else?
Mm-hmm.
Good, I'm safe then. And then currently live with your roommates.
Mm-hmm.
Anything else that you do in your spare time besides the exercising, pole fitness?
I mean, my friend Gerald used to come over, but that was every Tuesday night. He doesn't really
for that?
I just haven't really invited him over, I guess, lately. Like, I haven't really seen him in 2 months or so.
Okay.
We still like talk every now and then, but I haven't really hung out with him.
Alright. And then I think we're about done with that. So, real quick, I would like to do, it's called a situational analysis. So basically, I am just going to ask you a series of questions. Just tell me about your thoughts, feelings, behaviors, all during this time. So describe a situation when you were coming back from Nicaragua in the beginning, the middle, and the end. So getting on the airplane, coming here.
Before I even got on the airplane, just knowing I was leaving again was, really difficult. Like, because I didn't know when I was going to see them next again and things like that. Like, it's just really hard leaving my family because, again, we live 2 different places. So life happens, and I don't know if it's going to be another 5 years before I see them again, kind of thing. Like, it's almost like I was missing them before they were gone, knowing that I wasn't even going to be able to see them, or when I was going to see them again, if I was going to see them again, kind of thing. And then coming home and being away from them, that was really difficult. Just the realization of they're not here anymore, kind of thing. I just wish they were here all the time.
Okay. And then, what were you doing while you were returning? What were your behaviors? How were you,
I was just sad. Like, I was crying saying goodbye to them, and I feel like I kind of haven't really stopped crying about it. So.
Okay. What did you want out of that situation right then?
For them to come with me, or for me to not leave. Just wanted to be with them.
Okay. And obviously you shared some of the effects of these symptoms with me. Could you just reiterate?
I don't know.
Like after you came back and you started feeling these symptoms of crying and sadness.
I just withdrew from everyone that I even had here. I don't know why. It wasn't my family, and I just was so overwhelmed that I just didn't even have the energy really to make efforts here.
Okay. And what do you do to try to make your situation more manageable?
Sit in my room. I guess I haven't really done anything.
Okay. And what other situations have you experienced these symptoms?
I've never been like this before. It's scary.
Okay. So basically why I did that, and what I would like to go over with you, we're about to look at some goals that you would like to get out of therapy. And I just want to share with you, I primarily use the cognitive behavioral approach when it comes to therapy. So basically, just a brief explanation of what that means is that your thought process, your feelings, and your behaviors all correlate with one another. So in cognitive behavioral therapy, a lot of the times you might be thinking that your behavior is, or the situation, the event is directly affecting your feelings. But a lot of the times it's actually your thought process about the situation, how you interpret the situation. So, for example, in a positive regard, if you exercise, that's behavior. You start thinking, oh, I had a productive day, I went running, this is great. And then, in turn, after that thought and the event, you start feeling satisfied and happy. So it's just kind of showing how sometimes, especially when you're having depressive symptoms, somatic symptoms, anxiety symptoms, that your behaviors and your faulty thinking directly, affects what you're doing. And basically, we want to figure out some healthy coping mechanisms and how to change your way of thinking so that your behaviors follow behind that. Does that make sense to you?
Mm-hmm.
Do you have any questions about it?
Mm-hmm.
Okay. So we're gonna figure out some goals for you real quick. So list a few things that you would like to get out of therapy.
I mean, I definitely wish I was more in tune with my friends here again and not so withdrawn. But I also wish I was with my family, so I guess coming to terms with not being there or possibly going there or just having them in my life more.
Okay. And then, so you started kind of going in the direction of things that you wouldn't want. So, like, things that you wouldn't want, such as, not being around them and feeling sad. But what are some more things that you would want to see?
I guess just like being myself again, like kind of, I don't know, I just miss the way that like things were and I would work out and feel good about myself and be more socially active, and I haven't done any of that. I want to do that.
So something that we can definitely work on, since you want to be more socially active, you want to get out there, you want to be doing these things that you were finding, pleasurable before. I think that I have a really great activities checklist, and it kind of checks over everything. Community and helping others, and just, your health and wellness, your recreation, and it just gives you like a nice list of things that you could do. And they're, really broad, so it's nothing super specific. And it'll be like exercise. So, okay, today I'm going to do my full fitness that I really enjoy. How often do you think it's reasonable to do something on that checklist?
I mean, at this point, at least once a week, because I'm not doing anything, so.
Okay, perfect. That's a nice, objective, reasonable goal. So we can definitely, I'll give you a copy of that before you leave so that you can see. Also, I would like for you to try and get in touch with and communicate with your family back home. So I know for kind of like a homework assignment, I know it's kind of not the best term that you want to hear, but not many people want to do homework, but it's good for your life, make you happy. So is to see if that's even a possibility. If just talking about that and bringing it up.
Yeah, I can definitely try to get in touch more with my friends and family over there.
And then we also did talk previously about your stomach issues, and you said that you would be interested in learning some techniques to maybe help with that. So real quick, I just wanted to do a relaxation technique with you so that you can go home and practice. In everyday life, it's very easy. It'll only take a moment. So we'll practice it together if you don't mind. So if you just put your hands on your stomach
Mm-hmm.
and then your other hand on your chest,
Mm-hmm.
and you're going to breathe in through your nose and then exhale through your mouth like you're blowing on soup. Okay?
Okay.
So while we're doing this, what should be happening is to make sure it's a deep breathing exercise, which will help with your anxiety and will calm you down. Your abdomen should be moving, not your hand on your chest.
Okay.
Okay. So if you also don't mind closing your eyes, if you feel comfortable doing that, I would really like you to imagine a place that's very peaceful, maybe somewhere from your past, somewhere from your future that you would like to go, but a very just peaceful environment. And just keep breathing the way that we briefly practiced. That's a great one. All right, and whenever you're done. So how did that feel for you?
Relaxing. I just wish I was there, really.
Well, kind of gotta focus more so on here and now and what we can do at this moment. And, if you do that more and more, even imagining it, picturing it, will start to help relax you. And a lot of times your muscle tension, your body reacts differently to you being stressed, and it exasperates it. So if we can get you to calm down a little bit, which is great, doing those deep breathing exercises and the imagery together, it will help. It takes a little bit of time to learn, but if you could just do that for your other homework assignment, just try to apply it whenever you're feeling overwhelmed, or if you're about to get into a crying spell. Just try to do that and just come back with some feedback for me and let me know how it works. Okay? So, anything else you would like to talk about?
No. I think it's good. I covered a lot.
Perfect. And would you like to come back and see me?
Yeah. Yeah, I definitely would. This time usually works for me. Same day.
Perfect. Well, I have an opening available for you, and I look forward to seeing you next week. Okay?
Thank you.